Can recovery surpass expectations?
Early on that
Explore
makes
how
recovery
goals and
easier by improving
neuroplasticity
physical
redefine
functions and
rehabilitation
skills.
limits.
What do you think about that statement and why?
Well, it's kind of like nails on a chalkboard to most neuro PTs. Um, Healthcare is sequestered a little bit, so you'll have your ICU docs, your emergency room docs. You'll have your inpatient rehab docs, and oftentimes, they'll tell someone, and it's good to have realistic expectations. How much it might impact them, but they don't always follow those patients through their whole plan of care. And it's
Huh?
been cool in my career. I've been in the, acute side, the inpatient side, home health, and outpatient. So I get to see this span. And I can't even tell you how many times I've seen someone who had a stroke or some other neurologic issue, 5, 6 years ago, that has made tremendous progress. It all comes down to having a goal and having a plan to achieve that goal. The way our nervous systems work is they constantly adapt to new situations. So if you set up your environment to ask your body to do certain things and do it repetitiously and use the principles of neuroplasticity, you're going to see improvement with that task. And I can't emphasize enough that I've seen remarkable accomplishments years and years and years after someone has had a stroke. It used to be sort of a myth, and to a certain extent, there's truth in that. A lot of your initial improvements happen in that 3 to 6 months, and then from that 6 to 12 months. Um, but we've learned so much more about neuroplasticity and how the brain can continue to adapt and learn new skills that it's kind of it's a myth now. Your
Yeah.
recovery is not done at a year, and that's I think when you tell people that is sort of a self-fulfilling prophecy. If you stop working on these things because you think that's as much as you can be done, then that's absolutely as much progress as someone's going to make.